So driving is a huge issue for our patients, and especially in the South. I can't tell you how many people tell me, I started to drive when I was 12 years old, and I've never had an accident, and I don't understand why my family thinks I'm not safe to drive anymore. And that may be in spite of the fact that there are multiple bumps on the car, or that they've gotten lost, or there could be many different reasons. But it's a very sensitive topic, and it is very difficult for families to be the ones to say you can't drive anymore. And so we really, as healthcare providers, offer to families that we'll be the bad guy. We'll be the one to make a decision as to whether or not someone should continue to drive. And oftentimes we do that with the input of family. We frequently ask family members, have you ridden as a passenger in the car? What do you think about your family members driving? Are they following the rules of the road? I had one gentleman who watched his dad drive, and he went through a red light, and when he said something to him, he said, "Oh no, that's okay. That's fine, that's not for me." Clearly that's a reason why somebody perhaps shouldn't be driving anymore. If someone can't figure out how to get places, if you say, "Come on, why don't we drive to church?" and your family member is looking to you for directions, that's a cue that perhaps they shouldn't be driving alone. Sometimes, if there really are concerns about safety, just going to your family member's physician and saying, "We really think it's time. Are you comfortable telling mom or dad or my husband or wife that they can't drive anymore?" However, there are also driving assessment programs. There are lots of reasons why people have to stop driving. People can have traumatic brain injuries, they can have strokes, they can have other physical illnesses. And so there are trained occupational therapists who can do a formal driving assessment. It usually involves testing vision, testing reaction time, doing some paper and pencil cognitive tests. If people get through that portion of the evaluation, they'll actually take your family member out in a car and observe their driving and make sure that they're observing the rules of the road and whether or not they're safe to drive. That gives you reassurance both for the safety of your family member, but the other issue that frequently needs to be considered is just liability. If something were to happen and your family member had been given a diagnosis of mild cognitive impairment or a dementia such as Alzheimer's disease, what's the potential liability if something were to happen and someone were to get hurt?